Hello, I'm Amy Osoria, Doctor of Physical Therapy with Free Range Physical Therapy. Continuing our discussion on sacroiliac dysfunction. I did mention the sacroiliac belt a few times in some other videos, so I wanted to go ahead and show an example of one. This is one I just found on Amazon. It's pretty basic. It's called a Sacroiliac, and it's a little different than the kind that you get when you're not pregnant. Typically the SI portion covers a little more area, so I know some people complain about that and some people put rags there to cover the SI a little better, but really the compression is what helps the most. So it comes in two pieces. So we'll start with the belly support. So it's got the anti-slip. You just put it right under your belly. You can kind of feel the bones right here called the ASIS to feel where you need to go, right over that. And you pull it around, and when you get the instructions for this one, they recommend you lay down just so you can get it a little bit tighter. But I'm going to show it standing up today. So that's the first piece. And then you have your second piece, the long, narrow one. So the anti-slip things are the ones that go towards you. And the tag kind of helps for feel. I'm going to do this by feel this time. And you're going to place it right there over that sacral bone. And then you're going to pull tight. This one has the Velcro surface, so I'm going to pull that one first, and then this one will Velcro to it. So you want it nice and snug, and really the thing that helps is that compression. It's pushing your pelvis together, and you should feel that pressure immediately, a little bit of relief in that SI, and as you move, it helps that SI from over moving and causing inflammation in that area. So it's really funny. I bought this because I was having a lot of pain around 20 weeks, and I actually only needed it a few times. I did all the exercises that I had mentioned before, and I think the most important thing is not doing things that open your legs too much. So when you're putting on your shoes, try to avoid standing up like I would do before. When you're getting dressed, don't stand up, sit down. The best example is maybe to pretend like you're wearing a mini skirt all the time. Try not to open your legs too much. So getting in and out of the car, which I do home health, so that was my biggest issue, is I would just step out of the car fast like I was used to doing. But my main change is I now turn to the side and step down, and I think that's helped my pain a lot. But this got me through about a week of really bad pain that just came out of nowhere as the baby grows and as the hormones shift. So it's a good adjunct, but it's always best to do the exercises and kind of change how you're doing things also. So this is the SI belt, and like I said, some people prefer to put a little extra pressure right here, maybe a rag or something thicker. The pregnancy ones that tend to be more narrow to allow more room for the belly. And I haven't found a particular brand I like better than the other. This is just one I found on Amazon. So again, my name is Amy Osoria with Free Range Physical Therapy.